Hello students, welcome to the channel Physiology Redefined. Today I will talk about a very interesting phenomena that is to take place in our body. We have seen that in response to any injury of the blood vessels, there is a stoppage of the bleeding. And what for? That is for the prevention of the loss of the blood, so that there is no excess drain out of the blood out of the body, and thereby helps the body to maintain the homeostasis. So in this class we'll talk about how this stoppage of the bleeding is taken place, and that is the phenomena which is known as the hemostasis. This is known as the hemostasis. So here, what is hemostasis? Hemostasis is the combination of the two words hem plus stasis. Hem means blood and stasis means stoppage. So stoppage of the bleeding, and this is by the physiological mechanism, not by artificial means, not by taking any medicines or some other extramural therapy. So body itself is trying to prevent the blood loss by initiating some mechanism which is the physiological mechanism. That means hemostasis is the spontaneous stoppage of the bleeding by the physiological process. So let us define the hemostasis. The definition of the hemostasis, it is defined as the spontaneous stoppage of the bleeding in response to any vascular injury, by physiological mechanism. Here this term is very important, by physiological mechanisms. So this is the definition of the hemostasis. Now let us see how this physiological process takes place and thereby prevents the loss of the blood. This hemostasis is grossly taken place by three major events. What are those major events? Number one, that is the phases or stages of hemostasis. Number one is the vasoconstriction. And number two is the formation of primary platelet plaque. And finally there is a formation of secondary or permanent or definitive platelet plaque. So these are the three main stages by which hemostasis process takes place. Now let us see one by one how in these three stages the stoppage of the bleeding takes place in our body by the help of physiological mechanism. So as per the first stage is concerned, vasoconstriction is concerned, what's happened? This takes place in by mainly two processes. One is the direct neural process, direct neural reflex, and second one is the bihumoral mechanisms, by releasing some substances, humoral mechanism. Now we'll discuss how these two things, two event, direct neural reflex and bihumoral mechanism, how the vasoconstriction takes place. So what is vasoconstriction? How the vasoconstriction helps in prevention of the blood loss? As you know that if the blood vessel gets constricted at the site of the injury, at the spot of the injury, obviously there will be the less blood flow or obstruction of the blood flow. And if you know that if any pipe is leaked, and to stop the leakage, first thing what we used to do, we used to pressurize, we used to press that tube so that there is a less loss of the fluid through that leakage. So same thing here also is applied. Here body itself initiates the constrictions of the blood vessel so that less amount of the blood pass through that leakage and thereby less blood is lost from the body. So this is the process or main aim of the vasoconstriction immediately after any trauma or injury of the blood vessels. So we'll discuss in detail how this vasoconstriction will ultimately help or how this vasoconstriction takes place to cause the prevention of the blood loss. Now regarding the second phase, that is the primary platelet plaque formation. Here what's happened? The loose platelet are plugged, are accumulated on the site of the injury. Just like that, suppose if there is any breakage of the pipeline or the drain in front of your house, suppose. So what's happened? First things you used to do is to stop the dirty water to come out, to come through that drain, to enter in your house. To prevent that thing, what you used to do? You used to give some, keep some stones, sand particles, even clay in those breakage point so that no dirty water can enter in your house through that breakage drain. So same thing here happens. Once the vascular injury is there, if there is any, suppose this is the blood vessels and there is a leakage, there is an injury. So what's happened here? First there is a constriction, and second the platelets will be loosely adhered, clamped on the injured spot so that no blood is bled out of that injured area or injured spot. So this is the second phase, which is known as the formation of the platelet plaque formation or primary platelet plaque formation, and this is taken place by three processes. Number one is known as the platelet adhesion. We'll go details each and every phase. Second one is the platelet activation, and third one is known as the platelet aggregation. So these are the three processes by which the primary platelet plaque is formed on the site of the injury temporarily. And how this is taken place, that again I will talk in details. And final process, that is the formation of the permanent platelet plaque. This is formed by simply forming a network, by a reticular network around the, by forming a network, a reticular network around the aggregated platelet plaque, so that these platelets are entrapped within the network. So the platelets are not shedded off or shedded out in spite of the blood flow through that region. So these platelets are entrapped within this particular spot, and thereby there is a stoppage of the bleeding permanently, which is the process that is known as the blood coagulation. So this process, third step, is otherwise known as the blood coagulation. Blood coagulation. This one is otherwise known as blood coagulation. So these are the three main stages by which hemostasis is maintained. Now let us see how this hemostasis is mediated, is achieved by the help of these three major stages: vasoconstriction, primary platelet plaque formation, and the secondary or definitive platelet plaque formation. So suppose there is a vascular injury. Suppose there is a vascular injury. Now what's happened? In response to the injury of the blood vessels, because of the trauma, because of the mechanical trauma, there is a direct activation of the smooth muscles present around the injured spot, and that will result the direct neural reflex, nervous mechanism, direct neural reflex, by which what's happened? There will be the vasoconstriction. So because of the direct neural reflex, there is a constriction of the blood vessel takes place, that is known as the vasoconstriction. So here what's happened? There is a spasm, contractions of the smooth muscle at the site of the injury, and thereby that is known as vasoconstriction, and thereby there is a prevention of the blood loss through that injured area. Not only that, in response to injured blood vessels, what's happened? Vascular injury means, you know that the interior of the vessel wall is lined by very smooth endothelial cell layer, and beneath that there is a collagen layer which is rough. So what's happened? Just like this, here you see, suppose this is the blood vessels wall, and so these are the collagen layers, and immediately behind this there is a smooth endothelial cell layer. Now what's happened? Once the injury of the blood vessel takes place, this part, if suppose is injured, then what's happened? This collagen layer is now injury. This collagen layer is now, here you see, this is exposed. Collagen layer is now exposed. As the collagen layer is now exposed, what's happened? There is the platelets which are roaming here and there, platelets which are flowing through this, they will now come in contact with this rough collagen layer. These platelets will come in contact with this rough collagen layer, and once the platelets will come in contact with the rough collagen layer, there is a damage of the platelet wall. Platelet walls will be damaged. So that means what's happened? Because of the vascular injury, there is a exposure of platelets on collagen layer of blood vessels, and this results release of some vasoconstrictor agent. What are those vasoconstrictor agents? Like 5-hydroxytryptamines, serotonins, even thromboxane A2. So now these are the humoral substances. Which are also responsible for vasoconstriction. So this is the first step, that is the vasoconstriction, which is taken place by two substages, as I told, two factor, two event. One is the direct neural reflex, and second is the humoral mechanisms. By these two phases, vasoconstriction or first phase is taken place. This is the first phase or phase A, that the vasoconstriction is taken place. Now what's happened? As the platelets are now damaged, platelet walls are now damaged, there are some characteristic change of the platelets. What's happened? They will now swell up, platelets will swell up, and these platelets will swell up, and they will form some pseudopodia. And these pseudopodia, by the help of these pseudopodia, they will attach on the injured wall of the blood vessel. Moreover, these damaged platelets, they will contract now to release some granules, and these granules will ultimately release some vasoconstrictor agents, which are mainly the thromboxane A2 and the ATP. So this one is ultimately responsible for release of thromboxane A2 and ADP, etc. Now what's happened? Because of this one, so as I told, that second phase, that is the formation of the primary platelet plug, is due to the three events. Number is the platelet adhesion. So here I told that platelets are adhered on the wall of the blood vessels and get sticky on the wall of the blood vessels. That is the first one. In the second phase, they will release some substances like thromboxane A2 and the ADP. Now these substances will call the neighboring platelets. Now what's happened? These substances, these will release the thromboxane A2 and ADP, and this one will call other platelets. They will attract other platelets to be adhered on the injured side, and that is the process which is known as the platelet activation. So this one will result the activation of the platelets, activation of nearby platelets on the injured side. So platelets will be attracted, and that is the phenomena which is known as the activation of nearby platelets. Now what's happened? This will initiate the positive feedback cycle. That means they will again go there, will become sticky, will form the pseudopodia, will adhere on the injured side, and they will release some thromboxane to ADP in more concentration, and thereby more attractions, more calling of the nearby platelets on the injured side. So thereby this process, this is a positive feedback process. This will again positive feedback. This will initiate the positive feedback, and this, because of this positive feedback, they will be again attracted. And ultimately what's happening, because of this phenomena, because of the positive this activation, this will result the positive feedback mechanism, and that ultimately results the aggregation of the platelets, to form loose plug in and around the site of injury, and this is the phenomena which is known as the second stage, that is the primary platelet plug formation. Now what's happened? Once this one is going on, the same time, what's happened? There will be this phenomena. This one will stimulate the intrinsic pathway of blood coagulation, that I will discuss in my next video. So this will stimulate the intrinsic pathway of the blood coagulation, or the final steps of the hemostasis. On the other hand, this vascular injury, that also results the release of tissue thromboplastin, and this tissue thromboplastin will stimulate the extrinsic pathway of the blood coagulation, So details of these things I will discuss in my next video. Now this intrinsic pathway and the extrinsic pathway, these are ultimately responsible for formation of permanent platelet plug formation. So this is the final stage of the hemostasis process, and this final step is aided by this vasoconstriction, this phenomena, that is the primary platelet plug formation, and this in turn is aided by the vasoconstriction. That means vasoconstriction, first step helps the second step helps the third step, and thereby by the involvement of all these three stages, all these three events, vasoconstriction, primary platelet plug formation, and the secondary platelet plug formation or definitive platelet plug formation or blood coagulation, the prevention of the blood loss is taken place physiologically. That is the process which is known as the hemostasis. So thank you. In the next class I will talk about the coagulation process in details.